Are you at the point in your life when you're thinking about trying to get pregnant or starting a family? I'm Dr. Monica. I'm a board-certified OBGYN and mom of 3. And I want to just have a little fireside chat with you about how to actually go about conceiving a baby. We're going to talk about some timing of your cycle, when to have sex, and some things to avoid or maybe things to go ahead and do to help you conceive a baby. We're also going to get into some of those myths out there and go ahead and debunk those so you know what's actually good information and what isn't. So let's go ahead and get into it. So step 1 of having a baby is nothing to do with our bodies, but is certainly important for our overall well-being and our health as a person, is our mental headspace. So what I mean by this is I see people all the time, whether they're patients or friends or whoever, when they're starting to think about starting a family and getting pregnant, they have a lot of worries and they're concerned about if they're gonna have fertility problems and they're a bit anxious about how it's gonna go. I see this all the time and it's definitely understandable because there's a lot out there to be on the periphery of our daily lives where we see things pop up here and there. We see, in the news talking about the overall declining fertility worldwide. We see, on Instagram, someone posts the 5 scariest things about infertility. And then you see this story, infertility journey and the needles and the shots. And you have a friend who wasn't able to get pregnant and had to do IVF. And you have another friend who's been trying. And I mean, it's everywhere. And it's easy to see this all the time, all around you in your daily life and make you start to get a little self-conscious of yourself and worry about what things are gonna be like for you when you go on this journey. And I think a lot of where these things come from, especially from social media and from friends and people who share things online, I think maybe because I'm a positive, optimistic person, I think it comes from a good place because people are trying to show support for those who are having fertility struggles or raise awareness for infertility or educate about things that people who have to go through assistive reproductive technologies need to go through to have a baby. And I'm totally in support of that because those people need to know that they're seen, know that they are supported, know they're not alone. And there's a big place for that out there, and I will likely be putting out things on that line as well. But for the standpoint of someone who has not tried to have a baby yet, they're just starting this process and they're getting into this experience that should be joyful and fun and exciting, I think is a huge benefit to try to have your headspace be a positive outlook and optimistic and try to take those things that kind of eat at your periphery and give you worries and just let them melt away and just think about how this is a really exciting time in your life and go at it from as positive of a standpoint as you can. Don't think there's a problem when you haven't given yourself a chance to have things go right yet, is the overall message and step number 1 of trying to conceive. The other thing to remember is what normal timing is. It is normal to have a normal, healthy person who's having regular menstrual cycles to take up to a year to get pregnant. Now, about 80% of healthy individuals will conceive in the first 6 months, but it's completely normal to take up to a year. It's a complicated process and a lot of things that aren't overall problematic can just go wrong in one cycle to another where it just doesn't quite happen. And that's okay. And sometimes it does take that long and sometimes it happens right off the bat. Either way, up to a year is normal, so try not to stress out if it doesn't happen in the first couple of months. I'd also note to you that in the first 6 months, there's a little bit of a different approach in my mind to trying to get pregnant versus if it has been 6 months, but still within the first year of trying to get pregnant. And we'll talk about a little more specifically in a minute. So step 2, we've already got our mind in a great spot and we're excited about trying to get pregnant and have a baby. Step 2 is still before we're actually trying and is preconception optimization of health. So before you even get pregnant, what can you do to get yourself as healthy as possible? First thing that I tell anybody that learned this way back in med school, anybody of childbearing age should be taking a prenatal vitamin. So there are all types of prenatal vitamins out there. They're generally all about the same. The main things that you want are one that has 400 micrograms of folic acid. And an important thing to differentiate is that the gummy version of prenatal vitamins will not have iron in them. So if you're someone who tends to run more anemic or doesn't get a lot of iron in their diet, you may want to add in an iron supplement. But other than that, pretty much any over-the-counter prenatal vitamin is perfectly fine. And you should be taking this before you even start trying to get pregnant. So I wouldn't say to delay getting pregnant just to start your prenatal vitamin, but if you're planning ahead and can think of it, try to start your prenatal vitamins about 3 months before you start trying to get pregnant. And I certainly wouldn't delay to try to get prenatal vitamins on board if you're over the age of 35. So prenatal vitamins are kind of just a baseline for anybody who's of childbearing age. Something that you can do, which I love to see these type of appointments, is you can see an OBGYN for something called a preconception counseling office visit. And this is just a really forward-thinking idea where before you even start trying to get pregnant, or maybe in the early stages, you come in and see a doctor and you talk about your health history and you as an individual and what things you can optimize to make yourself as healthy as possible before pregnancy. So this is a really good opportunity to review any of your prior medical diagnoses, to look at any medications that you're taking. So let's say you're taking medications because you have chronic high blood pressure. Most of those medicines that are given typically for a non-pregnant person are not the ones we prefer in pregnancy. So a preconception counseling visit would be an opportunity for you to talk to your doctor about the medicines you're taking and either have them go ahead and switch it over to pregnancy safe ones, or have them work with your primary care doctor to recommend pregnancy safe medications that you can be on to still manage your health issues, but be taking medicines that are safe for a pregnancy. So medical management is certainly part of a preconception counseling visit. This also allows you to look at things such as your weight. So weight is an important factor for both getting pregnant and then pregnancies, and both on either end of the extremes of weight. So ladies who are underweight may sometimes see a little bit more of a struggle with getting pregnant, as this can sometimes affect having regular menstrual cycles and having ovulation. And similarly, ladies who are overweight may also see some issues with conception, but also once you become pregnant have increased risk of some problems with the pregnancy themselves. So prior to getting pregnant is a good time to try to get your weight as optimal as you can, whether that's by gaining some weight if you're underweight, or by losing some weight if you are in the overweight or obese range based on your BMI. Prior to pregnancy is a great time to do that because we do not recommend weight loss while you're pregnant. Another thing you can do beforehand that you can certainly talk about with a preconception counseling visit is your diet. So mainly just trying to clean up the diet, get rid of the processed foods, the excess sugars, try to do more whole foods, fruits, vegetables, lean meats, and then also getting things out of the diet that might be something you would avoid during pregnancy. I think it's a good idea to start getting your diet kind of molded towards a pregnancy diet. Now, you don't have to cut out sushi and a nice medium rare steak or things that we will recommend you change once you're pregnant, but it is a good idea to start cutting down on any high mercury containing fish like swordfish or shark if you're eating that type of thing, and move more towards the type of foods you'll be eating once you're pregnant, and just an overall healthy diet to just get you in the best state of health you can be in. Another thing to consider when we talk about what we're putting into our bodies when we're trying to be healthy are substances like cigarettes, alcohol, and caffeine. So cigarettes should definitely be cut out. There are a multitude of health reasons that cigarettes are not good for us. When it comes to fertility, smoking has been shown to decrease fertility rates, so if you're trying to get pregnant, you'll want to stop smoking. Also, that is a lot easier said than done. Quitting smoking is very challenging, and it's harder to do at any point in time, but I think it is harder for people to do when they're pregnant because they've got this guilt weighing on them too, where they know that they're pregnant, they know it's not good for their baby, and they've got that weighing into the already difficult task of quitting smoking, that I think it makes sense for multiple reasons to try and quit smoking before you're pregnant if at all possible. Now, when it comes to alcohol, there's no proven issue with alcohol affecting fertility. However, of course, we know that once you become pregnant, you should not be drinking alcohol. So this is something you frequent with, you might start to get your head wrapped around the idea of not having any more alcohol. And when it comes to caffeine, we have a safe cutoff range of 200 milligrams of caffeine a day, which is about 1 to 2 cups of coffee depending on the type of coffee that you're drinking. So this is something that we've seen in higher doses or higher exposure above 200 milligrams a day can lead to increased risks of miscarriage for pregnancies. So if you can get yourself into that 200 milligrams a day of caffeine or less, that would be ideal before you get pregnant, because certainly the earliest stages of pregnancy are more vulnerable for that type of influence. All right, so we've gotten through step 1, we're feeling great in our head, and step 2, we've optimized ourselves medically to get pregnant. Now, how do we do it? How do we conceive? It might seem like it's really basic, but there's a little bit of a way to go about it. And like I said earlier, there is a difference in how intensely you'll pay attention to trying to get pregnant if you're in the first 6 months of trying versus if you're in the 6 month to a year mark of trying. So here's a very basic way to think about conceiving when you've just started trying, you have no medical problems, you have regular menstrual cycles, and we're overall just kind of low-key seeing if we get pregnant. Well, first of all, let me talk about how your cycle actually works for timing wise. So When we think about a menstrual cycle, there's that kind of generic 28-day cycle that will often be mentioned for regular, and it's normal to vary a few days outside of a general range. If your overall range is within actually up to like 10 days, that's actually normal and fine. So let's say someone is 28-day, 30-day-ish cycle. The way that works is the first day that you start your period is day 1 of your cycle, and then the end of your cycle, the last day, is the day right before you start another period. So that's the length of the cycle. Now, your period lasts usually 5 to 7 days, somewhere in there. Your ovulation time, now this is what's a little bit interesting. It's often noted to be day 14 because we talk about a 28-day cycle. Now, when we look at the cycle, got a little board to reference here. So we said that day 1 is the day you first start your period. 28, we're saying about an average 28-day cycle, is the day before your next period. So that puts ovulation at about 14 days. Ovulation actually occurs in the middle of the cycle, and it breaks the cycle up from the beginning and the end. And both these sides have different names depending on whether you're talking about the ovary or the endometrium. But just for basics, we'll say the first half and the second half. Now, the second half of the cycle is actually the more consistent part of the cycle. So your period happens 14 days after you ovulate. So you only really know when you ovulated retrospectively 14 days before you get a period. This first half of the cycle is what's variable. There's less controlling how long this process takes. So this is where you can see variance in the cycle, both from one person to another and from cycle to cycle in the same person. So that's kind of the general breakdown of how the cycle works. And I'll go back and talk about this in another second. When you're just in the early stages of trying to conceive, an easy way to go about it is when your period stops. If you have intercourse every 1 to 2 days for 2 weeks afterwards, you should end up having intercourse and having sperm in the uterus around the time when you're going to have ovulation. It's a very general, very easy way to go about it. For someone who has regular cycles that are usually around 30 days or so. Now, to go back to our little diagram here. So we know we want to have sperm in the fallopian tubes when we have ovulation, when the egg is released from the ovary. So ovulation occurs around here. Now, sperm can live for about 5 days up in the fallopian tubes. So the more important days to be having sex is actually before ovulation, because those sperm that were all deposited and up in the fallopian tubes, they're still hanging out there for about 5 days. And we want them there waiting for the egg to be released so they're ready to find her and form an embryo. So about 5 to 6 days before ovulation is a fertile window, with about 2 days before and the day of ovulation being the most fertile times where you really want to be sexually active in that time. So that's kind of how you go about it. As you can imagine, if you're starting on day 5 or 6, going for 2 weeks, you're going to cross over this fertile time in a loose sense. You should be having sex around the time of ovulation. So that's a very easy, low-key, low-anxiety, low-maintenance way to go about trying to get pregnant, especially when you've just started trying. Now, something that people will ask is how often should they have sex? And there's the answer is every 1 to 3 days, just to give it to you flat out. Now, of course, it only takes once, but when you're actively trying, every 1 to 3 days makes sense. A lot of people will hear a recommendation to do every other day of having intercourse, which is a very good way to do it. The reason that specifically is mentioned is that semen samples will show a normal sperm count when there's been 2 days of abstinence from one ejaculation to another. Whereas less than that, we may see lesser sperm counts. 2 days and up will have normal sperm counts. But with that being said, there's also not been shown to be a decreased fertility rate if there is sexual intercourse or ejaculation every day. So whatever works for you. If you are able to do every day, that is fine. If that seems a little bit intense or too much, every 2 to 3 days is also great. A nice sweet spot is every other day, but any of those will certainly work. If you go longer than that, you may end up missing having sperm up in the fallopian tubes depending on the timing. So I wouldn't space it out too much more than that. And that's just the general range of what should work. All right, so now let's say it's been 6 months and you've been going about it very naturally, doing what we talked about earlier, but you haven't gotten pregnant yet. And you think you might want to take it up to the next notch of how to look into this a little bit more specifically. So the first step I would say, and I kind of encourage most people to use this anyway, but is to get a period tracker app on your phone. So what this does is you just record when you get your period and it takes note of it and it just keeps a record of your cycles. So it'll give you an average of how long your cycles last, how long you bleed for. It helps just keep a nice organized diary, like a menstrual diary really, which is helpful so that you can have at least a projected estimate of when your fertile window will be. Now, what's important to note is that a period tracker app is only working on historical information. It is giving you an average of your cycle and it's guessing when you're going to get your next period and it's guessing when you're going to ovulate next. It doesn't actually have any information about the current cycle that you're in. It's just an average. So I think it is useful in giving you that guesstimate and giving you that information, but it does have its shortcomings when it comes to seeing like the actual cycle you're at, any findings or clues for when you're actually ovulating. But I think it's a good first step to at least give you an idea. Maybe don't have the husband go on a work trip, at this certain time of the month because we know that we're likely to see a fertile window during that time. So step 1, period tracker app. The next step, and what is I think a lot more helpful, is to start using ovulation prediction strips. So these are small little strips that you'll do a urine sample of daily. You can start doing the samples after your period stops or around day 10 should get you in that range where you're going to catch when it changes. Now the little lines on those strips, that it's different than a pregnancy test where if you have a control line and any line at all, otherwise in the test line it's positive. An ovulation strip, you'll have a control line and you'll have a slightly positive line next to it for your test line. This will stay at a low level, and then and this is testing for the hormone LH, or luteinizing hormone, which spikes and peaks when you're about to ovulate. So when you test this strip every day, that faint line will abruptly get really dark. When you see that line get very dark, you know that ovulation is occurring within the next about 12 to 24 hours. So that's how those strips work. And that gives you information about your current cycle. It's looking at this hormone that we know is important for ovulation. It's showing that when it is actually spiking for this current cycle. And you know that once you see that positive test, you want to have sex every day around that time because you'll want to get as much sperm deposited as you can and as much sperm up into the fallopian tubes as you can, knowing that the egg is going to be released soon. Additional tests you can do to help you determine when you're ovulating is testing the cervical mucus. You'll find that this is done by looking at the vaginal discharge, and you can examine it to notice the consistency change. When it becomes thin and slippery and clear, that means it is thinning out and that ovulation is likely to be occurring within a few days. Another thing that many people will do is test a basal body temperature. So every morning take your temperature, and then when you see it increase above from what your baseline is, that is an indication of impending ovulation as well. Now, I find the ovulation prediction strips are the most helpful, both for you for planning your timing, and then if we do get to where it's been 12 months and nothing's happened, I find it helpful as a clinician to be able to look back and see, are you seeing positive tests? Are you seeing spikes in this LH hormone or are you not? That helps me to determine what might be going on and how I can help you. So that's the general rundown of what you can do to conceive. Now, the things that we talked about after 6 months, they are not things that you can only do after 6 months. You could certainly do those from the very start if you'd like. It really just depends on you as a person and what you think helps you feel better about the process. If you like having some control, if you feel empowered knowing more about what's going on with your cycles and with your hormones, by all means go ahead and do things from the beginning with test strips and period tracker apps, absolutely. If you feel like these things stress you out and might give you some anxiety and make the process not so fun, then wait on them. It's really whatever works for you. You know yourself best, and whatever you can do, of course, to make yourself feel most empowered and most in control and most relaxed about the situation is what I would suggest. Now, I do see a lot of things out there with these complex hormone testing kits and these expensive ovulation prediction kits, and I don't see any reason that that would be helpful. It gives a lot of information that isn't even really helpful to me if I were to see you after a year of trying and not being successful. Just the basic cheap over-the-counter or Amazon test strips are great for ovulation prediction kits. I don't really see a need to do all the expensive other testing, to be quite honest. So if that's something that you want to get into, of course, there will be no judgment, but I don't see a reason that you would necessarily need to do that. You know, we have to get into a couple of the myths about conceiving a baby. Myth 1, that there's a certain position that will help with conception. It's just not true. Once the semen is deposited in the vagina, the sperm are up into the fallopian tubes within 5 minutes, and they're even up into the cervix and the uterus within like the first minute of after they've been placed in the vagina. So as you can imagine, no change in position is gonna make a difference on them getting up to where they need to be. They get there really quickly, and that is independent of what position you're in. You hear this one all the time, that you need to have your legs up in the air. Not necessary. As we just said, everything gets where it's supposed to regardless of your position. One myth is that you can only get pregnant if you have sex on the day of ovulation, and this is certainly not true. As we talked about, sperm can live for about 5 days up in the fallopian tubes. So something that was, or a sperm that was present 5 days prior to ovulation could still cause a conception. And this myth, I think, is more important for people who are using natural family planning as a means of contraception, so trying to avoid getting pregnant. It's very important to know that you can get pregnant even if you're not having sex the day of ovulation. I don't generally recommend natural family planning for a means of contraception for anyone who seriously doesn't want a pregnancy, because like we mentioned earlier, you could have one cycle a little bit off from another, and if you had sex a day where you thought you still had like 7 days till you ovulate, but this cycle is going to be a short one, you can't undo it. The sperm are already there, and then you're in a bit of trouble. So that is certainly a myth when it comes to that one. Another myth is that men can have babies forever. And although it is true that men produce sperm throughout their entire lives, they do see a decline in fertility after age 50. This is a myth that's really important for me to address, is that extended use of oral contraceptive pills affect your fertility. And this is not true. Contraceptive pills, as soon as they are stopped, fertility resumes, and there is no long-term effect on someone's ability to get pregnant based on how long they use contraceptive pills for. Now, this is really important because people use contraceptive pills for contraception, but they also use them for medical problems like painful periods or heavy bleeding. They make a big difference on people's lifestyle and their quality of life, and I would not want anyone to avoid using them just because they're afraid that it's going to cause problems with fertility, because that is absolutely not true. There's a myth that you cannot get pregnant while you're breastfeeding, and although the hormonal process that is in the background while you're breastfeeding does work to suppress ovulation, it is not 100%, it is not reliable, and we don't consider breastfeeding to be a form of contraception. So you can get pregnant while you're breastfeeding. Anyone who does not want to get pregnant or would not want another baby while they're breastfeeding, we always suggest and offer additional contraception. And we have people who have all different responses to the hormones that are present when they breastfeed. Some people will not have a period the entire time they're breastfeeding. Some will go a few months and then their period comes back. Some have periods right off the bat, regular every month from the beginning. So as you can imagine, it's a variable response, and it's definitely not reliable for contraception. Now, with that being said, if somebody was trying to get pregnant and they were at a stage where they felt comfortable weaning and stopping breastfeeding, I would suggest they stop that to just improve their chances of having a good natural fertile cycle. So those are a few myths. That's a general rundown of how someone can start to go about the process of trying to conceive. I hope this was helpful. So that's a general rundown of things you can do to start trying to get pregnant.